Welcome to Startup Health TV. I'm Logan Plaster. My guest on today's episode, YelPaala, is a man of two cultures. His family's from Ghana, but he was born in the United States in Wisconsin. Navigating these two worlds taught KP a couple of important things. The first was the value of access to healthcare. You see, he realized that the level of care that someone receives shouldn't be dependent on where they live. The second thing he learned was the power of clear, contextual health communication. He pulled these two ideas together and started a company called access.mobile, which joined Startup Health in 2017. This company used big data to help healthcare companies communicate more effectively with entire patient populations, often over text message. They saw considerable success in Africa and then brought their platform and learnings to the United States. Now they're expanding those operations under a new brand they just launched called InOn Health. In our interview, we'll get into the brand launch as well as talk about how COVID sped up the need for data-driven healthcare communications. I hope you enjoy. All right, I'm here with KP YelPaala, the CEO and co-founder of InOn Health. KP, always good to catch up with you, and thanks for taking some time with me today.
Great, thanks to spend time with you. It's really great to spend time with you today, Logan.
You know, I want to start with a little bit of your history. Your family is from Ghana. You were born in the U.S. I just want to start by asking you, how did that experience, that upbringing, shape your perspective on healthcare?
Great, thanks so much, Logan. Yeah, so both my parents are Ghanaians. I was born here in the U.S., actually in Madison, Wisconsin, and I grew up in Northern California. So like any, first generation American, I lived a life of two different worlds or two different cultures, right? So, I grew up in a Ghanaian household with not only Ghanaian, but other African immigrant friends in our network, and also got to experience all the different elements of living in kind of a cross-cultural context, right? Being an American kid, going to school in the US, doing all the things that, an American teenager would do, but at the same time having this other experience, being a Ghanaian American, and also having extended family in Ghana. And so that shaped clearly a lot of my worldview and how we approach cross-cultural health innovation today.
How early did you feel like you wanted to be in the business of bridging those worlds?
So that was part of my lived experience, was bridging those worlds. And I think that, as a young person, when I went to university, I was always passionate about healthcare. So I thought I might go to medical school and maybe launch a hospital in a Ghanaian country or in Ghana or another African country. And I just thought I was always passionate about healthcare. I always felt like, to fulfill our fullest potential as humans, you need to be healthy, in the broadest sense. And also education is important. So those two things to me really shaped how I prioritize my career choices and what I do today.
All right, well, we're talking today because of your company InOn Health. And we'll get into the sort of brand shift that you've just gone through, which is exciting. I want to hear more about it. But before we talk about what InOn Health is, let's start with the central challenge. What was broken that you have been endeavoring to fix with this company?
Right. So what you observe about healthcare generally is that I like to say now we live in a mobile first world, but healthcare isn't. Right. And when we think about how we consume information through our mobile device, through texting, through apps, through other types of content. And if you look at how healthcare communicates with people, not only do we have a challenge around the channel, and particularly for cross-cultural innovation and thinking about all the different types of people that live in the US and how they consume information. So many of them consume information through texting, through mobile channels, but I realized healthcare wasn't doing that. And so as a part of our journey, it was really about how do we use mobile channels to better communicate with diverse populations so that they could fulfill their healthcare potential by accessing the services and other types of tools that they need for their well-being.
Is it about using SMS and text only, or is the way you communicate differently Is it different when you're using text?
Right, right.
Yeah,
So we started using the texting channel, and then we became multi-channel, right? As we scaled. So naturally you want to meet people with the appropriate information where they are. So
sure.
as you scale as an organization, you expand your channel. So we started with texting, and now we do lots of other channels. But then the secondary question is, what is being communicated through those channels, right? Like, what's that content? Does it resonate with different populations? We live in a tremendously diverse country. If you look at our most recent census, the most population growth we've seen in the US in the last 10 years has been in non-white populations, right? And so our population in the US is growing to be increasingly diverse. Yet healthcare has a challenge in trying to communicate content to all those different stakeholders in a meaningful way. Because what we know is if we don't communicate, people won't engage. When we think about healthcare disparities, that becomes a challenge.
Okay, so you're addressing the challenge of contextual communication on the right platform with the right time in the right way. That's the big sort of broken piece. So now let's get right into the platform. So what is InOn Health? How do you describe it to somebody?
So InOn Health, which is formerly known as Access Mobile USA, is a digital health communications company. And really what we're doing through communications is we're reducing costs, we're improving health outcomes. Our target audience are typically payers, healthcare payers, or large health systems who are serving these diverse populations. But in our context, there's something that's a bit nuanced, which is that, multicultural innovation typically describes communicating to people that come from lots of different types of backgrounds. But really, the nuance in what we do is cross-cultural. Cross-cultural communication and cross-cultural innovation isn't just about racial and ethnic diversity, but even if you think about our urban-rural divide, rural context in our country, it's a different culture, how they engage, right? And so when we think about cross-cultural innovation, we're thinking about all these different aspects of population in our country and how we reach them effectively. I think multicultural generally has inferred racial diversity, but not really looked at some of the nuance of other elements of our cross-cultural dynamics. You see now, I mean, front and center with COVID, right? We've seen that evolution in terms of the COVID pandemic and the different pockets of populations people have been trying to serve.
So how do you reach these populations better? Let's say it's a rural population and the current mode of communication for healthcare isn't effective enough. How do you do it better?
Ultimately, this is the third leg of the stool in our solution, which is about data. So ultimately, to think about communicating appropriately to people and to think about health equity at the heart of it, it's a data problem,
Hmm.
right? Our ability to use data to not just understand race and ethnicity, but place in terms of social determinants of health, communication preferences, clinical context, all of that is really about data. And so when we look at data today, ultimately what you want to be able to do is to use data to better segment your population and to better communicate. And what we're finding as well, even from our current administration, is a big push around how to improve data standards so that we, as groups like InOn Health, can be more empowered to truly communicate in that targeted way or to tailor any type of intervention appropriately.
So, if you were to make it really sort of simple and concrete, if I was a patient in a rural setting and maybe I'm confused by the mailings I'm getting from my insurer or from my hospital. Give an example of what a more contextual communication via text or whatever would look like, that uses the data of who I am and where I'm from and all of that. Like, how is it substantively different for me as a patient?
Yeah, so we, for example, ran here in Colorado the largest vaccination access and hesitancy study in the state to date.
Hmm.
And this was a study that we were funded to implement in conjunction with the Colorado School of Public Health. And what we were
Fascinating.
doing is trying to answer this exact question using data. Like, we knew that in Colorado, Black and brown populations and rural populations have been lagging with regards to vaccination access. We're working with COVID Check. Colorado is the largest statewide testing and vaccination program. What do you do to act, right? And so through that survey, we learned a few things. We learned that one, access barriers were actually a bigger problem than hesitancy across the board in our state. But we learned that for the Latinx population, their significant back access barriers were around not knowing where to go, for example. They wanted to know more about side effects of COVID. That was something that mattered to them, right? In other words, you can see how using that type of tool of capturing data now then has allowed us to communicate to those segments the content that matters to them. So based on our findings, we communicated to that segment more information about side effects. We thought at one point we thought that people actually had this data about where to go, and then we come to learn they actually didn't, right? And so then we started to communicate that an appointment wasn't required, that an ID wasn't required, right? So we were able to take those very concrete findings and translate them to communication, which then led to more vaccine access. So you could show the whole chain of figuring out what to communicate, communicating it, and then linking that to vaccination access.
You've touched on this a little bit, but how important is the science of communication, the word choice, when you're dealing with really trying to activate people through text or SMS?
I think the word choice is part of it, but the trusted channel is much more important.
Mm.
People are practical. They don't need fancy language, but they need to know that the content coming to them is content that they trust,
Mm.
right? And so the trusted messenger, as we've learned in the COVID-19 pandemic, is key. And that trusted messenger may be the healthcare institution, it may be the community org, it may be some other actor, but ensuring that that content is coming through that trusted messenger, or that trusted channel, is critical. And there are some tricks to behavioral science and how you word things that help, but ultimately we found that trusted messenger is really critical.
Interesting. That's a very interesting point. So now I want to know what's next for InOn. You rebranded from Access Mobile USA just this quarter, I believe. When did that happen?
Yeah, we just rebranded basically about 6 weeks ago. So
Okay.
in March or so. Yeah, late March, early April.
So how does that rebrand sort of set you up for the next phase of the company? What's the big objective?
So as some people know, we already successfully have been working in African countries for some years. And that organization that for some people have known us to do that work, we've worked in over 13 countries, we've reached over 1 million people. And that was part of our story of cross-cultural innovation, which goes back to my personal background. And so in this next phase of our growth, we really are focused on, how we take our learnings and really have a deep and wide impact in the US. We've been working on issues of cross-cultural innovation and health equity since the origins of the business. But we believe now at InOn Health, we can really double down on taking these lessons learned to serve more people here in our country. And so we're in a very exciting stage.
Who are some of the key partners that you're going after? Who's an ideal partner client?
So we have been working to date with both managed care and with large health systems since we launched in 2018 in the US. We work with Adventist Health White Memorial, which is the largest hospital in the Adventist health system, Emory Healthcare. We work with a group in rural Oregon. So as we're scaling, we're now continuing to work more in the payer space, particularly payers that serve diverse populations and large health systems.
How did the last year dealing with COVID change the conversation when you go and talk to a health system about digital communication?
So what's happened for us now is that things that we were explaining before, people seem to understand more clearly. So our organization actually has seen exponential growth during the pandemic because people started to understand that the need for data-driven, culturally appropriate, nuanced engagement has been the center of how we're trying to get to herd immunity in the US. You see it in the newspaper every day.
Yeah.
So something that we had before had to explain to the market about why cultural relevance matters, why cross-cultural innovation matters, why data and segmenting how you communicate matters. Those things we don't have to communicate as much anymore because it's out in the public domain. I mean, if you look at now how we're thinking about COVID vaccination, in the newspaper every day is like which population is lagging, which population is getting access, what are they learning about what's working and not. And that's really, I think, laid a foundation we're excited about. And we want to keep the momentum. We don't want this to slow down. When we think about racial disparities, health equity, these types of solutions like at InOn Health, and we need to continue to put our foot on the throttle.
Love it. That's the time that we have, KP. Love watching what you're building. I can't wait to see where that goes in 2021 and next year. Appreciate how you put this emphasis on access, on really communicating to people no matter where they are, no matter what those barriers used to be. And thanks for taking the time with me today.
Great. Thanks so much, Logan. Appreciate it.
All right. Take care. Be well.
Take care.
A quick word about this show, in case you're new around here. At Startup Health, we believe in broadcasting the stories of health moonshot progress, the stories of the most forward-thinking entrepreneurs in health. If you want more of this good news about healthcare's problem solvers, make sure that you subscribe to our channel, hit that notification button, and follow us on social media at Startup Health.